Hi, I'm Dr. Mark Hansen. Remember, I am the needle guy. The needle guy meaning I do acupuncture, I do Chinese medicine. I'm located in Dallas, Texas. If you're a doctor and you want to take some seminars after viewing this, go to my website, Eastern Medicine Institute, and you'll find the different seminars that I'm teaching. If you're a patient, if you're in the Dallas-Fort Worth area, I do a variety of different things, chiropractic, acupuncture, cupping, of course, and that's what this little video is about. I'm using plastic cups today. I'm going to show you another video later on with some glass cups. I like glass cups better, but that's just because I've used them for a long time. The plastic cup is very effective. Get in areas that are a little difficult, but what I want to do is show you moving cupping, or some people call it sliding cupping. So watch the video. Hope you enjoy. To begin with, I'm going to apply some massage oil. The massage oil makes it much easier to slide the cup or to move the cup around. So if you're doing any type of moving, a massage oil would be good. I normally use grapeseed oil, almond type oil, something light, not very thick. As you can see, I'm making small circles right now. There are a variety of different techniques that you can use, but a lot of times if you want to get over a particular area, then you just go in small little circles. When you feel that the suction is not as strong, you can release the top valve like I just did, and then you can reapply the cup to the body. I would tell you that normally you want to apply the cup to the pumping device when it's not on the patient. It's just more comfortable for the patient if you would do that. As you can see, we're getting quite a bit of a petechiae coming to the surface of the skin. You're going to get petechiae also in a technique called gua sha that is also very effective for this type of thing. I like sliding cupping or circular cupping, like I call that, just because I normally leave the cups after. As you can see there, I have changed my technique to moving up and down the spine. Up and down the spine is very comfortable for the patient, but you want to make sure that that you ask the patient if it's too strong or if it needs to be more strong. Once again, I'm going to apply the cups. Now I'm going to add more cups because I've opened up the surface of the skin. I've got the blood moving, and that's part of the whole purpose of this, is to get the chi and the blood moving throughout the body. So I normally will stack them up. I normally am going to go in a line along the spine, not over the spine, and then I intersect the previous two cups, as you can see that I'm doing here. That way you get closer, you get more the cups are closer together, you're going to get a better, stronger, more effective cupping technique, procedure, and response. So I would encourage you to maybe do what I'm demonstrating right now. As you can see, I've applied 6 cups to the right side of the upper back. I don't go over the spine. Over the spine is not really a good technique to do. You want to be to the right of the spine, over the paraspinal musculature. You want to have the cups staggered like they are so that you have a close proximity to the cups, and not that the cups are so widespread out. When they're widespread out, you do not get as good of an effect as if you were to have the cups stacked up like I've got there. Now you can see, as I was talking and time just went away very quickly, all of a sudden I got 6 more cups on the other side of the body. Normally, I personally, as a doctor, I would like to have cups on both sides. Whether the problem is specifically on one side or the other, it is always good to balance the musculature and the technique out. So that's why you really want to do cups on both sides. Maybe not as many, but you would want to do cups on both sides. To take the cups off, these are vacuum cups. They're very easy. As you can see, there's a little orangey shred valve or tab at the top. All you've got to do is pull up on it just a little bit, and it lets the air out. Sometimes you need to slide the finger underneath the plastic cup, but most of the time they come off relatively easy. So as you can see, we got a very good response. I've left the cups for approximately maybe 15 minutes. I actually left the cups on the right side longer than the cups on the left, but we got a better response. Not necessarily that the left side responded better, but that there was more blood brought up to the tissue, which is what we want to do, and that is going to help to relax the musculature and reduce the pain and reduce the muscle spasm. From a Chinese perspective, we would say that the red or the purplish area is where there was more qi and blood that was stagnant, that was stuck. So by doing cupping, by sliding it, by moving it, by leaving it for a period of time, we have brought the blood through the muscle tissue, we have got the qi to move, and the body's going to heal itself. Cupping is a very effective technique, reduces muscle spasm, reduces pain, it helps the body heal itself. If you're a patient, try it. If you're a doctor, you need to be using this technique in your clinic for your patients. I hope you enjoyed the presentation. Visit my YouTube channel often. Please subscribe to my channel. It'll just help me to be able to bring more different video content to everyone involved. If you're a patient, you really do need to try this technique. It will reduce muscle spasm, reduce pain, and you will feel a whole lot better. If you're a doctor, you need to learn the technique, help your patients get better, and live longer. I wish everybody well. Hope to see you again in the future.